Pencil tapping, pin clicking, nail biting, and leg bouncing. These repetitive motions are sometimes a crutch to those that have been diagnosed with anxiety or even just simply feel anxious. I personally have been diagnosed with generalized anxiety disorder, and simply being diagnosed has created a lot of opportunities within family and generalized society to bring forward a conversation about what diagnosed anxiety is. Mental illness still has stigma surrounding it, but also is becoming more and more talked about within family and society. So how anxiety is interpreted and discussed throughout media and other social situations further affects those that have been diagnosed in both positive and negative ways. There are several different forms of anxiety to start. So specific for phobias affects 8.7% of Americans. Social anxiety disorder affects 6.8% of Americans. Major depressive disorder affects 6.7% of Americans. Generalized anxiety disorder, what I have, affects 3.1% of America. Panic disorder has been diagnosed in 2.7% of Americans, and obsessive compulsive disorder affects 1% of Americans. According to the Anxiety and Depression Association of America, or ADAA, there are several factors that can lead to the development of anxiety disorder, including, quote, genetics, brain chemistry, personality, or life events, end quote. Not everyone is aware of the exact definitions of anxiety, and that can lead to misinformation, misdiagnosis, self-diagnosis, and even complete ignorance. Stigma, on the other hand, is a, quote, mark of shame or discredit. Its origins in both Greek and Latin mean a mark or brand, especially given to a slave, so that is meant to make them inferior. The general idea of stigma is a roadblock that can eventually lead towards either mistreatment of those diagnosed as mentally ill or the lack of people looking for the help because they are afraid of how they will be perceived as people when they are diagnosed with mental illness. The journal article Mental Illness Stigma, Problem of Public Health or Social Justice by Patrick Corrigan and his colleagues has a selection of text in which they discuss the idea of stigma that surrounds thinking of mental illness in a biological sense, which is how the, quote, public health approach believes mental illness should be discussed. This biological approach leads to the fact that, quote, people who endorse genetic casualty are less likely to blame individuals for their mental illness. However, the same group is also pessimistic that people with mental illness will recover, end quote. This, in turn, is a group of people that believe they are trying to aid those that are labeled as mentally ill but are actually further making the problem worse and creating stigma even bigger than there was before. According to a study of adolescents from 2001 to 2004, the National Institute of Mental Health, or NIMH, discovered that 31.9% of adolescents aged 13 to 18 are diagnosed with an anxiety disorder that will then stick with them for the rest of their lives. Even though there's been attention turned towards adolescents and the onset of anxiety, in many cases, child anxiety will remain unrecognized and untreated. Because the symptoms of anxiety during childhood can relate to things like homesickness, separation anxiety, attention and concentration struggles, difficulty with social behaviors, or low self-esteem, the diagnosis of anxiety can sometimes be overseen. When untreated, adolescent insomnia can continue into adulthood and cause long-term symptoms that can lead to even more stress, prolonged anxiety, and further lifelong complications, including but not limited to self-medication or non-prescription drug use. Morrison and Story use the term, quote, down in the dumps, but to be synonymous with, quote, anxious, end quote, which is a common phrase to use as a descriptor towards moody children. They state that identifying sleep disturbances in an adolescent is easy as asking a few questions and then keeping track of sleeping patterns, and following mood swings can determine if there is a worry of adolescent insomnia. So, if we are able to determine if sleep aids are needed, why is there hesitancy in diagnosis? Well, a study from 1978 states that adolescents being prescribed sleeping aids is inevitably harmful and, quote, toxic, end quote. There is an intrinsic fear that is instilled in the minds of almost everyone wary of medication that is heightened when put into these situations. So, staying with the topic of adolescence and moving away from the worry of medication, the stigma that surrounds adolescents that are diagnosed with or even present symptoms of anxiety fall to the fear of peer bullying. This idea plays into the stigma that surrounds mental illness, and this goes to show how young these ideas are instilled into children. The article by Despacito and her colleagues, titled Adolescents' Vulnerability to Peer Victimization, Interpersonal and Intrapersonal Predictors, earlier stated that the peer victimization that is prevalent in society eventually leads to feelings of anxiousness or depression. For the students that are being picked on because of their outward appearance or symptoms of being anxious and depressed, there is a circle being formed of being victimized because of their diagnosed mental illness. Children and adolescents who are being picked on for their symptoms will try and suppress them instead of seeking help, which will then flow into the idea that there is no way to get help when there is no way to diagnose. So while it does feel rather impossible to completely eradicate the idea of childhood and adolescent anxiety, preventative measures can be extremely helpful in taking away stigma as well as preparing those being diagnosed with further knowledge that will help them as they age. According to Jessica Minahan and Jerome J. Schultz, quote, stress and excessive anxiety impairs the brain's ability to process, acquire, and store new information, end quote. This inhabitation of new information to be processed leads to what we know to be called the fight, flight, or freeze reaction, and even erratic behaviors in the classroom or even defiance of the teacher. Commonly, when a student hits this reaction and either lashes out or freezes up, there's a misdiagnosis of attention deficit hyperactivity disorder, or ADHD. Lastly, discussion of anxiety disorders and mental illness within media and our society has become pivotal to understanding not only disorders themselves, but also coming to terms with the idea that anxiety is a worldwide phenomenon. Adam Busby, who is from the TLC show Outdaughtered, is the father of 6 girls, with 5 of them being quintuplets, and he became honest with reviewers about his postpartum depression. Commonly, we think of postpartum depression in the eyes of a mother, but in an article in 2017 with People magazine, Busby states, quote, I want men to feel comfortable opening up about their feelings and expressing the struggles they're going through. I want to help end the stigma surrounding mental health, end quote. He stresses the fact that he wants other men to feel comfortable in discussing situations like the one he's in. Also, Chris Evans is most famously known for his role as Captain America in the Marvel franchise, a character that spent the early part of his life fighting off Nazis, in the later part of his life fighting off aliens and more Nazis. His role is extremely masculine and extremely confident, yet the actor has admitted to falling victim to his anxiety at points. He almost didn't take the role as Captain America out of fear. In an article with Men's Health magazine, he discusses how he's managed to control his anxiety at times when it's almost got the best of him. When he asked about why he said no, Evans said, if the strings attached are 6 movies, that's a scary loss of control that I just wasn't ready to process. He also went to his therapist to discuss his actions. While his actions aren't completely breaking stereotypes and getting rid of stigma, simply admitting that he has a therapist that he regularly seeks out is kind of breaking down that masculine concept of men in society. Lastly, the Child Mind Institute is, quote, an independent national nonprofit dedicated to transforming the lives of children and families struggling with mental health and learning disorders, end quote. And they kickstarted a project called the #MyYoungerSelf Initiative, in which athletes, actors, and other celebrities talk about their struggles with mental illness or learning disorders to try and fight the stigmas that surround it. Kristen Bell, known for her acting and voicing of Anna in Frozen, talked to herself in a video about how you must take care of yourself first, even in the wild ride that is Hollywood. At one point she states, quote, never feel embarrassed or ashamed about the uniqueness that is you. Belle was diagnosed with anxiety and depression at age 18, and the words she chooses to tell herself are uplifting yet very simple. Sometimes to be able to get past the bigger hurdles that come with anxiety, you have to start on the smaller side. So, in conclusion, the stigmas that follow mental health happen in a broad sense and in a very personal basis as well. I remember when I was first diagnosed, I wished my parents never discussed it with my family. Now, as months have gone by and I have become more comfortable with my diagnosis, the conversation has become more open, and even though I still have to explain to myself, to other members of family or friends how I may think different or respond to situations in a different manner, that doesn't mean I am other from them. Stigmas are not something that can be immediately forgotten. They're so ingrained into our society that breaking such practice could potentially take years. Yet I believe that progress can be made through open discussions and attentive listening and learning by those who aren't diagnosed, whether they know someone who has been diagnosed or not. Thank you.